Ladies, if you're over 65, the way you talk during your doctor's appointments could be putting your health at risk, and it's something few people talk about. I've seen it happen far too often in my practice. Older women come into my office and unintentionally sabotage their own care, simply because of their communication style. In this video, I'm going to break down the 7 biggest communication mistakes I see older women make with their doctors and how to fix them. Stay with me until the end, because the 7th mistake is one that even the wisest women make without realizing it. Before we dive in, please give this video a thumbs up, hit that subscribe button, and let me know in the comments. Have you ever left an appointment feeling like you weren't truly heard? Mistake number 1, being overly polite and not conveying urgency. I've lost count of how many older women have walked into my clinic speaking with such kindness, humility, and gentle manners that I'd want to give them a gold star for being the perfect patient. But let me tell you something that might be a little uncomfortable. In a medical setting, being too nice doesn't help you. It hurts you. Let me explain why. Doctors, especially in busy practices, are trained, consciously or not, to triage. We listen not just to what you say, but how you say it. So when a woman comes in and says something like, "Oh, it's probably nothing. I just didn't want to take up your time," it automatically registers in our minds as low priority. We're human too. If you signal that it's not important, we might subconsciously agree. But here's the kicker. Many of those probably nothing cases turn out to be something serious. A nagging cough turns out to be early-stage lung disease. A little fatigue is actually undiagnosed diabetes. It's not your job to decide how serious something is. It's your job to present it clearly. You don't have to be rude. You don't have to barge in and yell, but you do have to be firm. Instead of, "I know you're busy, I just thought I'd ask," try, "I've had this issue for 2 weeks and I need to figure out what's causing it." That simple shift in tone shows that you value your time, your health, and your body, and it teaches your doctor to take you seriously because you take yourself seriously. Mistake number 2, using vague descriptions that lead to misdiagnosis. Let's talk about a classic example of how being vague can lead to poor care. I had a woman come to me, a lovely 72-year-old lady, and when I asked what brought her in, she said, "I just haven't been feeling like myself lately." I followed up, "What do you mean by that?" She replied, "I don't know, just off." Now I appreciate her honesty, but as a doctor I need details to do my job. Feeling off could mean anything. Fatigue, anxiety, dizziness, nausea, low blood pressure, a heart rhythm problem, even early dementia. It's like telling your mechanic, "My car is acting funny," and expecting them to fix it without even popping the hood. I gently encouraged her to be more specific, and eventually she admitted she'd been having dizzy spells every morning when getting out of bed, plus trouble remembering small things, like where she'd put her keys. That was a major red flag. It turned out she had low blood pressure from a medication issue and the early signs of vascular cognitive decline. If she hadn't opened up, we might have just written it off as getting older. So here's my advice to you. Be as specific as you possibly can. Before your visit, write down what the symptom is, when it started, how often it happens, what makes it better or worse, and how it's affecting your daily life. That information is pure gold for your doctor, and it can be the difference between being dismissed and getting a breakthrough. Mistake number 3, staying silent when something feels wrong. There's something I hear far too often, and it makes my heart sink every time. A patient will say, "Oh, I just figured it's my age. I didn't want to make a fuss. I guess these things just happen when you get older." Let me tell you right now, just because something is common doesn't mean it's normal. Yes, aging brings changes. Your joints might get stiff, your sleep might change, your skin might thin. But you know what isn't just old age? Chest tightness, sudden fatigue, blurred vision, unexplained weight loss, new digestive issues, major mood swings, or frequent falls. The danger here is normalization. You experience something new or strange, and instead of investigating it, you quietly absorb it. You adapt. You endure. And that silence delays a diagnosis. It gives preventable problems time to grow into dangerous ones. I had a patient who'd been feeling a pressure in her upper chest for months. Nothing unbearable, just enough to notice. She assumed it was arthritis or maybe reflux. But when she finally spoke up, it turned out to be a partial blockage in a coronary artery. One bad day away from a major heart attack. Please listen to your body. If something feels wrong, it probably is. And the sooner you speak up, the better the outcome. Mistake number 4. Downplaying symptoms to avoid seeming dramatic. There's a quiet epidemic among older women. It's not a virus or a disease. It's the fear of being labeled a drama queen. I see it all the time. A woman will come in with real serious symptoms, but instead of owning them, she'll package them in disclaimers. It's not that bad, really. I'm probably overreacting. I'm sure you've seen worse. You know what's really happening? You're shielding me, the doctor, from the burden of your pain. You're trying not to be too much. You're worried about taking up space. But let me tell you with all sincerity, you are not too much. Your health is not an inconvenience. Your pain is not a joke. I had a patient who came in complaining of a little stomach discomfort. She rated it a 4 out of 10, but her face told a different story. She was pale, tense, and wincing with every movement. After some gentle prodding, she finally admitted she'd been in severe pain for days, but didn't want to make a big deal out of it. That little discomfort turned out to be acute diverticulitis. It required a hospital stay and a course of antibiotics. If she had spoken up sooner, we might have avoided that entirely. Minimizing your symptoms doesn't make you tough. It makes it harder for us to help you. So please give us the full picture. If it's an 8 out of 10, say it's an 8. If it's waking you up at night, tell us. If it's affecting your mood, your appetite, or your ability to move, tell us all of it. You deserve to be taken seriously, and that starts with taking yourself seriously. Mistake number 5. Letting someone else speak for you when you shouldn't. Now let me be clear. There is nothing wrong with bringing a loved one to a medical appointment. In fact, I encourage it in many cases. A second set of ears can help catch what you miss, and it's comforting to have someone there. But there's a subtle shift I've seen happen with older women that worries me. At some point, many start to cede the entire conversation to their children, spouses, or caregivers. And in doing so, they lose control of their own health narrative. I remember one appointment vividly. A daughter brought in her 75-year-old mother. The mother was perfectly capable of speaking, thinking, and expressing herself. But the daughter answered every question before her mother could open her mouth. "What have her symptoms been?" I asked. "She's been dizzy." "How long has this been going on?" "About 2 weeks." I finally turned directly to the mother and said gently, "Do you agree with that?" She gave a small smile and said, "Well, actually, it started about a month ago, and I did pass out once." A huge detail, completely missed. Here's the problem. When someone else speaks for you, they might not get it quite right. They might miss emotional details, downplay the pain, or forget the timeline. They're filtering the story through their lens, not yours. Even worse, as you stay silent, doctors may start addressing your companion instead of you. And when that happens, you risk becoming invisible in the one room that's supposed to be all about you. Unless you are cognitively impaired or feeling very unwell, you need to lead the conversation. It's your body, your life, your health. Let your loved ones support you, but don't hand them the microphone. Speak up. Interrupt if you have to. Say, "Actually, I'd like to explain this part myself," because no one can tell your story better than you can. Mistake number 6, failing to ask follow-up questions. Here's a truth that might surprise you. Doctors aren't always great at explaining things. It's not because we don't care, but because we're trained in a language that's often clinical, rushed, and full of jargon. We toss around words like benign, inflammation, and mild degeneration, and expect patients to understand what that means for their lives. But many older women don't want to seem difficult, so they just nod politely and say, "Okay," even when they are completely confused. This is a huge problem. I had a patient who left an appointment thinking her diagnosis of moderate stenosis meant she had cancer. She spent 2 weeks in a panic, losing sleep, fearing the worst, all because she didn't ask what the term meant. And I, unfortunately, hadn't explained it well enough. Here's what I want every older woman to remember. You have a right to understanding, not just information. Understanding means, what does that word mean in plain English? How serious is this? Is this something that will get worse? What are the treatment options? What should I be looking out for? How will this affect my daily life? If you don't understand what your doctor said by the time you leave the office, don't leave. Ask, clarify, insist if you need to. Doctors work for you. You are not there to impress us or make us comfortable. You are there to get clarity about your body and your future. And good doctors respect patients who advocate for themselves. In fact, those are usually the ones who live longer, manage chronic conditions better, and avoid unnecessary hospital stays. So next time you're at the doctor's, don't just nod and go. Speak up, take notes, and don't leave until it all makes sense. Mistake number 7, not bringing notes or leaving without them. Now I want to share something practical, because this mistake is extremely common but completely preventable. When older women come to appointments without notes or leave without written instructions, they forget things. It's not a character flaw, it's just how the human brain works, especially under stress or in an unfamiliar environment. Let me give you an example. I once diagnosed a woman with mild heart failure. We had a 30-minute conversation about medication, fluid monitoring, daily weights, and sodium limits. She nodded along the whole time. She even said she understood. But when she came back 2 weeks later, her ankles were swollen, her weight was up, and she had no idea what fluid retention meant. When I asked, "Were you doing the daily weights?" she said, "You wanted me to weigh myself?" The truth is, she simply forgot, and that could have led to a hospital admission. So here's the rule. Write everything down before your appointment. Write a list of your symptoms with approximate dates, any specific worries or questions you want answered, and any recent changes in your medication, diet, or energy levels. During the appointment, either take notes on what the doctor says or ask them to write down the instructions for you. If your memory isn't great or if your handwriting is shaky, bring a small notepad and ask the doctor to jot it down for you. Most will be happy to do it or will have your companion help write it down. And afterward, review those notes. Keep them in one place. Bring them to your next visit. Think of your health as an ongoing story, and your notes are its journal. Without them, you're relying on memory. And let's be honest, even doctors forget things if we don't write them down. Each of these mistakes is not a sentence, but an opportunity to change how you approach your well-being. When you start to speak clearly, write down your symptoms and ask questions, you become your own best health advocate. This is how you build the power that extends your life and preserves the quality of every single day. So if you want more practical advice, make sure to subscribe and hit that notification bell. And to help this video reach more women, please share it with your friends or family members. After all, taking care of our health is something that connects us all.